Hey, it's time for Daily Dose with Dr. Lazar, and I'm going to talk to you this morning about something that's really near and dear to my heart. And the question for you is, what do colic, difficulty nursing, ear, nose, and throat problems, sensory problems, and sudden infant death have in common? That's what we want to talk about. Today's going to have a special announcement, so if you're watching this live, the announcement will apply to you. But if you're not watching this live and this is something you're watching later, obviously the announcement for the workshop won't be relevant. What those conditions, colic, difficulty nursing, ear, nose, and throat trouble, in kids, tonsil problems, adenoids, tubes in ears, sensory problems as they age, anxiety, ADHD, autism spectrum, pervasive developmental disorder, sensory processing disorder, sudden infant death, those all have a very, very common link, and that is spinal cord compression at the very, very top, brainstem pressure at the very top. I talk about this a lot because as an upper cervical clinic, we work exclusively with pressure on the brainstem, but kids need to be evaluated for that. The nervous system is what controls growth and development while we're in utero, and then as soon as we're born, it's not any less important. It still is extremely important. The most important for growth, development, progress that we make, and so there's never a better time than to have a properly functioning nervous system than right after we're born. And the problem is, in the United States, our births can be very traumatic. Vaginal deliveries and cesarean sections both have very similar statistics. So I'm giving a live workshop Wednesday evening at our office at Lazar Spinal Care. I'm posting a link right now to that. The tickets are $15 a piece, and that's just so we can cover the cost of staff time to be there for the workshop. But this Wednesday, 6 p.m. until 7:30, we're doing a workshop called Delivered. It's on traumatic birth syndrome. And so here's who needs to know about that and attend. If you have kids at home, definitely you need to be at that workshop, and you need to hear some things you can look for. Now, if your kids have any of the symptoms I just mentioned, by all means, you can come to the workshop if you want, but you could skip the workshop and just have them checked. We could just do an assessment. But the workshop is all about traumatic birth syndrome. If you are pregnant, you definitely need to be at that workshop. If you want to become pregnant, you definitely need to be at that workshop. If you have grandkids, you need to be at that workshop, because it's information that you're not getting other places, and I'm not the only one that has it. I'm not quite sure why you're not getting it other places, but definitely want to make sure that you have that information. So one of our biggest passions at Lazar Spinal Care is empowerment and education, and we want you to reach your full God-given potential. If you've got a kid with colic or had a kid with colic in the past, even if they're 15 or 20 today, they still need to be checked. If you have a baby who is having difficulty nursing or latching on one side, by all means, bring that baby in to get checked. If you have a kid that has had ear, nose, or throat trouble, has had their tonsils out, has had their adenoids out, they've had tubes in their ears, by all means get them checked. If you have a kid with sensory problems, ADHD, difficulty focusing, anxiety, autism spectrum, sensory processing disorder, pervasive developmental disorder, we're going to be talking about those. And just so you know, I'll let one of the statistics out of the bag before Wednesday, but when it comes to sudden infant death, 7 out of 8 babies that died of sudden infant death have spinal cord compression and nervous system damage. If your baby is still alive, if your child is still alive, obviously they didn't succumb to sudden infant death, but wouldn't it be important to know whether they have that pressure on their brainstem or not? So we're going to be talking about that Wednesday, and please join us for that. There's a link below. If you have questions, please post those. The workshop will absolutely sell out, so make sure you get your tickets. We can only seat a limited number there, and that always fills up. So that's our special announcement. What all of those conditions mentioned in the title have in common is that they're all a result of traumatic birth syndrome, and so we can't encourage you enough to get checked for that, to have your kids, your grandkids, your nieces, nephews, everybody needs to be checked for that. I hope you have a fantastic day. I'll be back here tomorrow for another Daily Dose with Dr. Lazar.